Life after 50, erasing the lines of time. While many people live very comfortably in their skin as they age, some are looking for a more youthful appearance. Dr. Philip Miller is a facial plastic surgeon at New York University Medical School. Dr. Miller, good morning.
Good morning.
Nice to see you. Be here. What causes your skin to wrinkle in the first place?
Well, there are two changes that occur as we grow older. The actual composition of the skin, the texture changes so that we get fine and deep wrinkles, as well as some color changes. The second thing that happens is there's a change in the elasticity of the skin, so it actually will fall forward, and we create the deep lines here in the jowl region.
So you're saying that basically there are two different kinds of wrinkles that people have to deal with?
That's correct. There are static wrinkles and there are dynamic wrinkles.
Okay, give me an example. And you can do it on my face if you want. That's okay.
No. Static wrinkles are actual changes within the skin itself. So at rest, without moving the muscles of facial expression, we see those wrinkles. Dynamic wrinkles are those wrinkles.
This.
Exactly. Dynamic wrinkles occur when
the muscle
below the muscles below the skin pull on the skin, and so when we use the muscles of our face during smiling or frowning, we'll see those wrinkles.
Right, and sometimes do dynamic wrinkles turn into static wrinkles? For example, like frown lines, or what do you call that little thing there?
Brow lines.
The brow lines. Because you've moved your face so much, then it sort of is a permanent wrinkle in your skin?
That's correct.
Okay, now let's talk about some of the things that people are doing these days, because it's amazing some of the technology that exists. The first is a laser peel.
That's right.
Is that where they really sort of almost burn the top layer of your skin off?
It's one modality of a general concept, which is to injure the skin. And if you injure the skin, it will actually regrow in a more youthful appearance than it was before. So one method is a laser peel.
We have an example. Wow, that's pretty dramatic, yes, Dr. Miller, don't you think?
This is actually a deep peel with a CO2 laser, and you can see on the left a photograph of static wrinkles throughout the face, and then this is a photograph just 14 days after the procedure on the right.
Wow, so the recovery period isn't that long, is it?
It takes a good 14 days, but you can get good results in a short time.
And your skin is quite red and raw right afterwards?
That's
How much does that cost generally? I know it varies, I'm sure.
It varies from state to state, but it can anywhere from $2,500 to $7,500.
And how long does it last, the results?
It brings you back to the state at which you were when you had that skin, and then you'll continue to age from there.
Okay. Another method I know that is very popular, I mean, I can't believe how many people do this, and young women do it too, and it's Botox.
That's right.
Which is basically botulism, isn't it?
That's correct. That's absolutely right. It's a numbing agent, or a paralytic agent, which numbs the muscles. And as I mentioned, the dynamic wrinkles, which are caused by muscles pulling on the skin, can be anesthetized either as we raise our eyebrows, or as we squint, or as we smile. It will actually numb those muscles, and so we won't see those dynamic wrinkles. And here we see a photograph of a gentleman before, where there are wrinkles on the sides of his eyes and what are called the crow's feet, or the smile lines, and then after the botulism, and after the Botox injections on the right.
So usually, isn't Botox usually done for forehead lines and for brow lines?
It can be done for any dynamic wrinkle, so really in the forehead region, on the sides of the eyes, and actually now it's being used a little bit on the neck.
Now you have to do this once every 4 or 5 months?
It only lasts 4 to 6 months, that's correct, so re-injections are required.
Is it expensive?
It runs anywhere from $600 to $1,000, again, depending upon where you are.
Is it painful?
Only the injection, only the needle. We can apply a numbing medication on the skin so that even the needle injections aren't uncomfortable.
And what about long-term studies? I'm sorry, the idea of injecting my face with botulism makes my skin crawl.
Okay. The medication has been used for strabismus, which is a problem with the eyes, as well as for people who have tics, muscle spasm, muscle tics of the face.
Right.
And has those long-term techniques, studies have been done, and it does very well.
What about collagen injections?
Okay, collagen injections are different than Botox, because while Botox acts on the muscle and isn't really a filling agent, collagen and new techniques called Symetra fill the skin from below.
Does that work well, and how long-lasting is that?
That works well. The new product Symetra can last up from 6 months to a year or so.
Okay, here's an example of...
This is Symetra injection before and after. We're addressing specifically the deep lines between the nose and the mouth, and we filled out the region on the right side.
All right. Well, Dr. Philip Miller, thanks so much for coming in. We appreciate the primer on wrinkles and what you can do about them. And we'll be back in a moment, but first, this is Today. I feel like on NBC.